the foundation of the Vantage Point program is building relationships, getting a better understanding of oneself, increasing their inner strength to find that they can do difficult things. When your child comes to Vantage Point, they're supported by a collaborative professional team, starting with your field guides who are with them on the day-to-day, with their clinical primary therapist, with their psychologist, Dr. Carl Smoot. We all work together in order to best assess your child and meet their individual needs. My name is Jamie Kaczmarek. I'm a clinical social worker. My undergraduate degree is from Indiana University in outdoor recreation and psychology. My graduate work is from the University of Utah in social work. I've been working in the wilderness industry for the past 14 years, starting off as a wilderness field instructor, going on to a wilderness guide trainer, becoming a team leader, and then went on to graduate school and became a clinical therapist. We serve high-functioning adolescents, both males and females, 13 to 17, and then our young adult Vantage Point program serves 18 to 28. A Vantage Point student might have anxiety, might have depression, might be on the autistic spectrum disorder, might have nonverbal learning disorder, struggle with social relationships, or withdrawal from activities that they like to do, kids with learning disorders, with attention deficit disorders, with social deficits. Often they have executive functioning deficits. Overall, it's kids who don't really fit in, bringing all their issues and problems and the things that they stuff inside and release that and project that at home. You know, it's just they don't get what's happening in the world and they need more assistance with that. They need more role modeling to understand the social pragmatics of the world. What are the social rules? How do I have reciprocal conversations? Why don't people talk to me? And those describe more of the kids that are coming here. You know, they can have friends, they can be on sports teams, you know, they can be involved in clubs. Just a lot of it is they might have a friend for a little bit and not be able to keep them for long term. They might not understand what it takes to have reciprocal relationships or to not just focus on one thing. When they don't understand the big picture or understand the world and how they fit into it, tend to isolate. They make their world smaller. They might get fixated on a certain thing, whether that be a science or a math or running or a sport or a baseball team. Their goal is to gain more control, you know, and making their world smaller. And so part of Vantage Point, what we do is put a pause on making things smaller and helping reintroduce the world in a way that they understand it, in a way that they understand how they are part of the world. And we do that experientially. We do that by being able to role model how to ask clarifying questions, how to not be the center of attention, to advocate for oneself. And all this is done in the Vantage Point program with a high student to staff ratio and experientially. So in the moment, we will teach and guide and role model and mentor and support what your kids are not understanding in a way to make it really, quote unquote, normal.